Hello, dear participants of the conference. I am Семенова Ангелина. I am the first-year student of the pediatric faculty of Saratov State Medical University. Unfortunately, due to my limited medical experience, I cannot cover all the topics of interest to me. But still, knowing such a section of anatomy as angiology, I will be able to discernible such a pathology as a stroke. I am also interested in the methods of treatment, prevention, and detection of this disease. Stroke is an acute circulatory disorder in the brain, accompanied by the development of structure change in its tissues, as well as the appearance of persistent organic symptoms lasting more than a day. There are two types of stroke, hemorrhagic and ischemic. Vascular diseases of the brain are one of the leading causes of morbidity, mortality, and disability in Russia, and every year more than 450,000 people develop a brain stroke. According to the National Stroke Registry, 31% of stroke patients need outside help to take care of themselves. 20% cannot work on their own, and only 8% of the surviving patients can return to their previous work. Stroke is the second leading cause of death in the developed and third leading cause of death in the developing countries. Studies demonstrate angioplasty and stenting to be safe and effective. Technical success rate of angioplasty and stenting is up to 98–99%. Arterioles and veins leading to the brain can be vulnerable to narrowing, often caused by atherosclerosis. Atherosclerosis is a buildup of fatty substances and cholesterol that accumulate in the inner lining of blood vessels. If blood clots form, dislodge and flow into the brain, stroke and ischemic attacks can occur. For patients with atherosclerosis in their brain, neck or spine, minimally invasive balloon angioplasty and stenting may be recommended. Balloon angioplasty uses catheter-based endovascular techniques to reach the inside of the blood vessel at narrowing. A balloon is then temporarily inserted to expand the narrowing spot and restore normal blood flow. In addition, a stent may be placed at the location of narrowing to more permanently prop it open. Intracranial angioplasty and stenting may be used to open nerved arterioles inside the brain, preventing strokes in patients for whom standard medication had failed. Extracranial angioplasty and stenting is performed to treat narrowing in vessels outside of the brain. Carotid artery angioplasty and stenting is used to restore blood flow in the carotid artery of the brain. And vertebral artery angioplasty and stenting is used to treat patients with stenosis at the origin of the vertebral artery. It's no secret that stroke is a terrible disease, but is it possible to somehow predict its development? There is a project Brain 4.5 which aims to familiarize citizens with information about stroke, its symptoms, and emergency response measures. Each letter and abbreviation of a certain phrase, the meaning of which is in case of a violation of muscle activity and speech, it is necessary to have time to call an ambulance, since surgeons have only 4.5 hours to provide surgical intervention. And in conclusion, I would just say that despite the innovations that are being introduced into our medicine, it's necessary to remember about precautions in order to be able to provide the necessary assistance to those who need it at some point. Thanks for your attention.